Organ transplantation, liver transplantation. Indications in children and in adults. Indications in children: cirrhosis, metabolic causes. Indications in cirrhotic children: biliary atresia, congenital hepatic fibrosis, congenital hepatic cirrhosis. Indication in children having metabolic disorders: glycogen storage disease, alpha-1 antitrypsin deficiency, galactosemia, histiocytosis. Indications in adults: cirrhosis, metabolic, and neoplastic. Cirrhosis indications in adults: primary and secondary biliary cirrhosis, chronic active hepatitis, sclerosing cholangitis, alcoholic cirrhosis. Relative indication. Metabolic indications in adults: hemochromatosis, Wilson's disease, Budd-Chiari syndrome. Neoplastic indications in adults: fibrolamellar tumor, primary small intracapsular hepatocellular carcinoma on top of liver cirrhosis. The tumor should be localized with no metastasis. Technique of orthotopic cadaveric liver transplantation: total hepatectomy for the recipient, including an inferior vena cava segment. Positioning of the cadaveric graft into the site of the excised liver. The anastomosis in orthotopic cadaveric liver transplantation. Anastomosis are recipient to donor: suprahepatic inferior vena cava, infrahepatic inferior vena cava, portal vein, hepatic artery, and common bile duct. Advantages of living donor liver transplantation, LDLT. Thorough donor screening, optimization of timing for transplantation, minimal cold ischemic time. No hazards of graft storage. Lower recipient mortality compared with waiting for a deceased donor. Disadvantage of living donor liver transplantation: poses a risk to the donor. A risk of death of the donor is present. It is minimal but not negligible. A risk of bile leak. Psychological impact if the graft fails. Both donor and recipient affection. Hepatic transplantation complications: technical complications, rejection, recurrence of the original disease in the grafted liver, complications of immunosuppression. Technical hepatic transplantation complications: vascular occlusion, vascular stenosis, bleeding, bile duct leakage, bile duct stenosis. Hepatic transplantation results: 85% 1-year graft survival, 50% 5 years graft survival. Good luck and best wishes.